prime time to begin our webinars. So if y'all will give me just a moment to attend to some housekeeping here. We want to go ahead and go live on Facebook for our Facebook family. And then also we want to make sure that you all are aware of some of the housekeeping things here. So we'd like to welcome you all to our May monthly webinar. We are absolutely thrilled to have Dr. John Terry with us speaking today about prevention and treatment of mental health concerns in military connected youth and military families. We are the Behavioral Alliance of South Carolina. We are a grant-funded initiative out of the Office of Special Education Services in the Department of Education, housed in the University of South Carolina's Department of Psychology's Research Lab. So I want to give us just a moment to get a few more participants on board. So for those of you who are joining us by phone, please know that at any point, if you want to engage in conversation with Dr. Terry, you can press *6 on your phone, and that way you can make sure to ask any questions. However, Dr. Terry has been incredible and made sure that we will have time at the end for a little bit of Q&A, and of course, in very much Basque fashion, we will be making sure to increase connectedness. If you have questions afterwards, you can always reach out to us through our webpage at www.schoolbehavioralhealth.org/Basque. This webinar will also be housed on there. You will have access to the slides afterwards. We are grateful for your attendance today. We are thankful for your time, and we are exceptionally excited to be able to uplift this conversation, and especially to have someone who is so incredibly close to our Basque team and to the school behavioral health community, and Dr. Terry. So if you have questions throughout and you are participating either on your phone or on your computer, please know that you can put those questions into the chat box. I will pause Dr. Terry's presentation and then pose those questions to him so that he can answer. I will be your primary point of contact. My name is Taylor Davis, and I am the proud program manager for the Behavioral Alliance of South Carolina. So with that being said, and to respect time, I think, Dr. Terry, this is where I turn it on over to you. Please share with everybody who you are and a little bit about what we're going to be able to hear from you today.
Yeah, absolutely, Taylor. Thank you so much for a warm welcome. Yeah, it is good to be here with everybody today. I know it is May 28th, and summer is right around the corner, and there might actually be a summer with appropriate social distancing and safety stuff, but I know everybody is very excited to get back a little bit to whatever enjoyable summer is possible, but I definitely appreciate people taking the time to talk about a very important topic. You know, I am a school behavioral health person by training. I did my PhD at the University of South Carolina. I started working with the school behavioral health team back in 2012. Back then, it was called school mental health, but as I'm continually reminded now, we use the word school behavioral health to talk about a broader sense of both treatment and prevention and promotion. So Mark sometimes has to remind me, hey, look, we're school behavioral health. School mental health. We don't use that term because we are very much focused on behavior, prevention, promotion, thriving, well-being, all those good things. So today I'm going to talk to you about another passion area of mine. After I did my training at South Carolina, I was one of the first graduate students to enter the military after I did my PhD. I did my internship at a Air Force internship training site, Wilford Hall in San Antonio, Texas. And then I was a Air Force psychologist active duty for the next 3 years, and did a couple different things. My last duty station was Robins Air Force Base, where I was the officer in charge of the mental health element within the mental health clinic, and also did a fair amount of suicide prevention program management work as well. But I've always considered myself a school mental health person. So after the military, I returned to South Carolina and was wanting to get plugged back into a good team and some opportunities to do some excellent research. So Mark said, yeah, hey man, we got some great work for you. It just so happens that what you're interested in doing with mental health treatment for military families and military connected youth is really in line with what we're trying to do with one of the themes of the Behavioral Alliance of South Carolina. Let's get started with a little bit of some of this work and some of what we hope to accomplish today with this webinar. We can't accomplish everything, but my hopes are that people leave with just a little bit better understandings of some of the stressors and some of the unique challenges as well as strengths that military connected youth and military families experience. There are a lot of really great resources for both prevention, treatment, promotion. I'd like you to leave with a couple of just really helpful pointers and some good places to get started. But this is a very apropos time for this webinar because there is some great resources and initiatives going on both regionally in the Southeast, but then especially in South Carolina. So I'd love for all the attendees to be able to walk away with some knowledge of some of the great stuff going on in South Carolina. But just by way of introduction, military families are our nation's families. They serve with military members, and military service creates some significant challenges by the unique demands of military life, not just in terms of deployment or combat or some of those types of things, but being in the military and being a family member of a military service member can create some significant challenges. And there are some really great programs and resources and organizations out there to support military members and their families. But just given the complexity of some of these systems, there are some substantial gaps for military service members, despite the efforts of all these people doing some really great work. But there's some efforts to kind of prevent and ameliorate that in South Carolina. So just to get started, to give you a little picture of some of the complexity, you think it would be pretty simple to just count all military members and all military service members. And in some ways it is pretty straightforward, but then when you start to really kind of look at what the total force look like, things get more complex. And counting matters because in terms of service eligibility and what type of services military members and military family members can get plugged into, things like what their status is really matters. You know, when we think of military, we typically have the stereotype of just active duty. You know, somebody who is wearing the uniform full time. You know, they're active duty service member, they belong to a unit, and that's their full-time profession as a military member. But there's a lot of other statuses to include reserve, inactive ready reserve, National Guard, a few different types of status within the National Guard as well. So counting can actually become somewhat challenging. You know, if we look at just active duty service member, there's about 1.3 million. We have ready reserve, we have about a little over 1 million. Then we have this whole group of DoD civilians where some of them can be in uniform, some of them cannot be in uniform. Then we have reserve status, and then people going on and off orders. So all this is broken down in a report that's published by the Department of Defense, usually on a yearly basis. I put a little screenshot of the report at the bottom. It's called the Profile of the Military Community. But there's a lot of complexity in terms of how we count military members. And then when you get to the state level and how you capture who belongs to a military family within a school, things can become a little more complex. So when we're thinking about how many military members are in a state and how many military family members are in a community and how many military connected youth are in a school, we need to think a little bit more carefully to make sure that we're actually capturing everybody that we intend to. And a lot of times it's the reserve and the National Guard, and maybe if a family member is going on and off active duty orders, it's a little bit challenging to kind of capture some of those folks in terms of counting. So just something really important to keep in mind. Here I have some data for active duty members. Sometimes it's easier to kind of conceptualize and wrap our mind around active duty. Coming from the DoD background and as a former Air Force psychologist, our entire job is to make sure that the military service member is ready to deploy and do their job. And the military is pretty unapologetic that their mission is to enable national defense and fight and win wars. And their job is to be ready to do that. But kind of coming at it from a different perspective, there's no profession, there's no job that you're really able to do if your family members are not doing well. Heaven forbid, if I had a family emergency right now, I would log off and go attend to that family emergency, and I'd say, hey, Taylor, take it away. Active duty and military members a lot of times don't have that same luxury. So somebody has to make sure that their family members are taken care of, so they can go off and do their job. So where we intervene matters, especially there's a lot of focus on the military members sometimes, but if families aren't healthy and families aren't doing well, then it's very unlikely that member is going to be ready to deploy or to go overseas or to do whatever difficult job we're asking them to do. So family members, there's about 1.6 million active duty family members. There's about 1.3 active duty service members. So there's actually a larger family population than military population. So it's really important to make sure that we are supporting military youth and military families in the same way that we're supporting the military member. In the Southeast, we are overrepresented in military members and military family members. It's very much the case that military families live in every state, and they even live internationally or outside the continental United States, OCONUS. But military members are found in the Southeast region more than any other region. So I have some data here. I have it sorted by number of dependents in the second column, states, of course, in the first column. And then I have a number of active duty personnel, and then the rankings and number of where they rank 1 through 50 in terms of the largest number of active duty members in the United States. So if you count Texas in the Southeast, that's number 2. Texas is a weird country in and of itself, so it's kind of hard to categorize Texas. North Carolina, yeah, they're in the Southeast. We can claim North Carolina. Virginia, yeah, they're in the Southeast. We can claim them. Georgia, number 5. Florida, number 6. South Carolina, number 9. And we are right in the middle of these southeastern states. So I would argue South Carolina has a lot to contribute when it comes to regional effort to support military families. In just case you were curious, California is number 1, Hawaii number 8, Colorado number 10. I put Alabama on here for one reason, and that is to just show that Alabama is last in the Southeast at something. So go Gamecocks. So military families are just like every other family. However, they have all the same stressors plus all these unique stressors. Most family members don't have to worry about deployment. Military family members do. They don't have to worry about the service member being injured or killed, or they don't have to deal with the impact of combat trauma, physical disability. Reintegration after deployment, which is huge and significant, and probably what I would recognize as probably one of the biggest challenge for every military family member is relocation and regular changing in household dynamics. So I said deployment. This is definitely unique to military family members. This is data that was published in 2018, but I would consider it newish data. Before this, it had been some time before there were data on what deployments actually looked like over the past decade. And from September 2001, obviously a big historical point in time for our nation after the September 11 terror attacks to September 2015, 14 years. There were almost 3 million, but 2.77 million individual service members deployed. But importantly, it's often the case that military family members deploy more than once. And depending on branch, the Army deploys more than anybody. And depending on special duty code, or what the Air Force calls Air Force Specialty Codes, or MOS in the Army, depending on your job, you might be more likely to deploy. So yes, 2.77 million individuals deployed, but there was a total of 5.4 million deployments. So that's 5.4 million times that somebody had to leave their family and go overseas. Transitions, also another very common reason for military family member stress. As I mentioned, military family members don't just live in the Southeast, they don't just live in the continental United States, they also live outside the continental United States, going to places like Germany or Japan. And most military family members or service members, on average, will spend about 2.9 years at each duty location. So, you arrive in beautiful Columbia, South Carolina, beautiful Charleston, South Carolina. You would predict that you're going to stay almost 3 years there. But in the course of a 20-year military career, on average, there's about 9 transitions across the typical 20-year military career. So these frequent transitions create a lot of problems for prevention and treatment, especially treatment, depending on acuity and chronicity and all those different issues that come up in mental health treatment. You can imagine that every time there is a transition within multiple systems of care. And I mentioned some of that OCONUS data. Per the DoD, in 2017, there were about 80,000 military family members living in Europe, about 76,000 living in Asia. Drastically different countries, drastically different cultures, drastically different systems of care. And if you're living in a place somewhere in Asia, then it's very unlikely that you'd be receiving any services whatsoever in the community, but you'd be receiving those services on base. Probably same thing typical for Europe. But military family members go back and forth across these drastically different geographic areas pretty frequently. And if you really want to have a very boring read, if you're having trouble with sleep, I recommend something from the Government Accountability Office. They published a report that's saying in 2014 there was about 646,000 what's called a permanent change of station. And I recognize that it's probably alphabet soup sometimes, but anytime you hear a military member or family member say PCS, they mean a permanent change of station. That means that they're the family member or they got orders to relocate, and they're assigned to a new unit in a different area. I was always curious in the military why people PCS so much. It doesn't really seem like it's necessary all the time, but there is some rationale, some reason behind it. The most common reasons for military service members and therefore their family to complete a PCS is if, number one, that there's accession into the military, that they go into the military. So a PCS from Columbia, South Carolina, completed some training on the way, and then ended up in San Antonio, Texas. If they have to do some type of training that requires a significant period of time, there can be a permanent change of station to a new duty location for training. Operational moves, rotational moves, unit moves, where the entire unit is moved somewhere else, and then separation from the military is pretty much the final reason for a permanent change of station. So there is some data that suggests that there's an accumulating negative effect of all these changes on military family stability. And it's a major source of stress for service members and their family. If you can imagine moving every 3 years for the past several years, everything is pretty much different in your life. Taylor, I see you there. Does that mean we have a question?
We do. I got a direct question from one of our participants, and I think you were actually kind of leading into it. But just out of curiosity's sake, they were wondering, you know, what are the things that the school or the district could be doing to have early identification of these young people that may be transitioning into their schools, as well as what, in your recommendation, would be some additional supports that they could provide to support the youth as well as the family.
Yeah, absolutely. Great question. And I think we'll touch on that in some later slides, but just one thing that we're attempting to accomplish with this webinar and everything during COVID is connectedness. School connectedness is one of the best protective factors for youth and for families. So there is some really great resources out there for enhancing school connectedness. But you know and you know, I would always hear stories of people who have been in the military a lot longer than me, but you know, really doing a good job of, you know, having things like sponsors and sponsor families from somebody coming from one duty location to another duty location. South Carolina has some really great initiatives and programming that will hopefully address specifically some of those program type questions. But yeah, connectedness is by far one of the best predictors of students doing well once they arrive to a new school. So all of these transitions create challenges for family stability, but then also constraints for providing mental health treatment. So just imagine going from San Antonio, Texas to Macon, Georgia to Charleston, South Carolina, all in a matter of 3 years and a little bit of change. And there's a lot of things that families have to contend with. They have to get services in new schools. You know, they have to get new community supports. You know, imagine things like changing churches or finding a new place for your family to attend religious services, helping agencies, and then new both military clinicians and civilian clinicians as well. A lot of people really develop great relationships with their providers, and then they're required to go and find somebody new, and that can be a very significant challenge. And especially if there is some type of special need going on with a family member. One of the last cases that I worked with in the military before I separated was you know, with a technical sergeant whose daughter was diagnosed with autism. And we were in central Georgia, and the wait for ABA therapy was over a year. Her behavior was getting worse. His anxiety was getting worse. You know, everything in this situation was just seeming to get worse, you know, to the point where they were dealing with some pretty significant meltdowns, and there were just no services in very rural Georgia at the time for this service member's daughter to get engaged with. So they ended up having to do what was called a humanitarian PCS for family reasons. This person was, you know, taking another job, and there was a I'm sure probably a difficult time period in terms of replacing what they were doing in their duty station. And then the only place that they could get service the quickest was in Washington State. So here's another PCS just to get services for a child diagnosed with autism. And that was a big challenge. But if things continue, that member wouldn't have been able to function and do their job. So it was definitely called for in that instance. So there's a program for this. It's what's called the Exceptional Family Member Program, or EFMP. And it is designed to ensure that if you have a family member that is enrolled in the EFMP program, that if you get orders as an active duty service member, there is supposed to be services that will meet that family member's need in wherever that they are PCSing to. And it doesn't have to be something like autism or mental health. It can be any medical condition that requires some type of special services or some type of specialty services. But when working well, this is a great thing. You make sure that you don't get orders to go somewhere like Minot, North Dakota, where there's very little hopes of getting whatever type of specialty care that your family member needs. But what if you're at a point in a military career where you have a couple of promotion options, and the first available one is Minot, North Dakota? That produces some opportunities to increase stigma. If you're a military family member who is working hard to advance in their career, but at the same time, there is a lot of duty assignments being limited based on where your family member can get services, there could be some possible iatrogenic or negative effects based on having to make those types of decisions. So it's something to be concerned about and worry about for sure. Yeah, hey Taylor, I see you again.
Hey, I love popping in on you here. You're obviously really touching on a lot of, positive and insightful, commentary. So we've got one of our participants here that was curious that if they were to request, or would requesting humanitarian PCS affect the soldier's chances for advancement?
It's a very strong depends. And the answer is it's definitely not designed to. It's designed to prevent those types of things. And to be fair, every family needs to, or has to, or is required to make those types of decisions when they take a new job, or there's a promotion in this state that's halfway across the country. Should I take it? Is it good for my family? Is it good not for my family? But there is more choice there. Where in the military, if you have a family member who has a medical condition and they're enrolled in the EFMP program, the choice isn't as much as that first scenario that I described. And that's why in research context that the military is considered a vulnerable population. They don't have as much right and freedom to choose. They don't have as much autonomy as everyone else because of their service and because they are a military member. So the question is, it's not designed to, absolutely. Do some of those things come up, and are they real challenges? Yeah, if you ask some family members and service members, yeah, but they would say yes to that.
So would your recommendation then be that this is one of those pieces of the puzzle that would be incredibly important for providers, for our school counselors, administrators, and those advocates to be very aware of when having these conversations?
Yeah, absolutely. As a psychologist in the military, consent and risk to benefit is always important when a patient is establishing care. I think in the military, it's even more important that you do a good job in terms of consent and explaining what risks there are to treatment and what benefits there are to treatment, and what type of privacy issues might come up. So yeah, absolutely. It kind of goes the other way too. I was speaking with a member that's associated with a district in South Carolina, and it was a staff member, and they worked as a mental health person in a school, and a family was coming up and saying, "Hey, yeah, we really love it in our school. Our child is doing really well with the programs and the classrooms and everything that they're in right now. We're likely going to get PCSed. Is there anything that you can do to support us in staying here?" And that's a challenge. That's definitely the role of the exceptional family member program. But sometimes it's the case where family members want to stay because a school and a school district is great and excellent. But part of the deal with the military is that yeah, you have to move from time to time unless there is some way to qualify for an EFMB program that a child needs in order to thrive and to do well and to have education that is appropriate. So yeah, it's there's a lot of issues here, and I'm trying to be careful with how I describe everything. But yeah, as a clinician and as a school staff member, yeah, these are very real world things. Sometimes a lot of these things can have impacts on people's lives and careers.
And I think, to that end, you're doing a wonderful job. I've gotten multiple pieces of feedback here that's saying that what you're saying is very accurate. There's a gentleman that said he did 20 plus years of service as a naval officer, moved 13 times with their daughter in high school, attended 6 schools. This is Dr. David Snow, Director of Military Affairs from the Board of Regents of the University Systems of Georgia. And then we have another one of our participants that's saying, as a parent of a special needs child, we were reassigned due to lack of services for our child on the spectrum. Luckily, we were approaching retirement, or it would have definitely affected advancement in his career. So you're looking at that kind of that spectrum of experience, seems to be doing quite due diligence to our participants. So I will cut out after that and fill you in as our very active. We're grateful for our active participation in this conversation. So back to you.
Great. Well, I feel more connected already. I thank you for the great comments and questions, and please keep them coming. So we are in May for a few more days. May is the month of the military spouse. April is the month of the military child. May is the month of the military spouse, and November is the month of the military family. So everybody, please keep that on your calendars. But it being the month of the military spouse, I had to put some information here up on military spouse well-being. And a lot of this data comes from RAND and some of their evaluations that they do on what's called non-medical counseling programs, specifically Military One Source and MFLAC, Military Family Life Counselors. Great programs, but they're considered non-medical because they typically do not take notes. A lot of the information that they do in terms of their counseling isn't entered into an electronic medical record. That they can meet military family members in school. They can meet military spouses for coffee, and as long as the situation is private and appropriate to do somewhat what they would consider non-medical counseling. And non-medical counseling is counseling. It's supposed to be a counseling for conditions that don't necessarily meet the diagnostic criteria for a mental health condition. But yeah, it's counseling, and it's a really great program. I put the national number for Military One Source there on the bottom. But really great information. But yeah, that there is stigma, and I think the Congress and whoever has funded Military One Source recognizes that, and you know, MFLAC and Military One Source is a great way to access services that do not get charted and don't necessarily enroll you in something like EFMP. Not that EFMP is bad, I don't want to give it a bad name, but in order to increase access and opportunities for military family members to engage in services, you know, Military One Source and MFLAC are excellent services. But in the evaluations of those programs, military spouses say about 45% they have more than normal stress, about half I'm feeling anxious, and about a third says that they're feeling depressed. Top reasons for counseling: marital problems, mental health concerns, and then just what they would call 11% said, yeah, I'm stressed. Mental health and military connected youth. In general, depending on what estimates you look at, about 1 in 4 or 1 in 5 youth would meet criteria for you know, disruptive behavior, a mood disorder, a mental health condition. Here is where the data is a little bit unclear, maybe. In general, the research with samples for military connected youth say that yes, there is more risk for academic performance problems, depression symptoms, behavioral problems, you know, emotional difficulties, suicide, substance use, and if their parents are in the Guard or Reserve, that there's a slightly elevated risk for family members compared to active duty. And there's a lot of very protective things about being attached to an active duty component. You know, if you deploy with an active duty unit, you come back to an active duty unit, and you know, there are tons of supervisors and protective things there to check on you and make sure that you're doing okay, and make sure that your family has everything that it needs. As opposed to Guard or Reserve, a lot of those protective things might not be as present. You know, so imagine, you know, being activated, being put on active duty orders. You go and complete a couple months of training so you can do your deployment. You do a year-long deployment. Now you're gone a year and 2 or 3 months. You come back and you're probably excited to get back to work at whatever company you were working for. And a lot of those resources might not be as readily available as if you were in an active duty unit. So there, when you look at the samples of clinical data, or some of these samples coming out of research, you see that yes, active duty or military connected youth are at risk, are at greater risk. There is an excellent report that's published on a yearly basis, and it's published to the South Carolina Educational Oversight Committee just on the performance of military connected youth. I put a screenshot of the 2019 report. The good news is that it says that in South Carolina, military connected youth are doing really well, that they're more likely to graduate than non-military connected families or youth. They're likely to do better on standardized testing. That they're likely to do better than a lot of the rest of South Carolina students. I would say that that's probably not a suitable comparison. You know, if you can compare military connected families to all the rest of the students in South Carolina, yeah, that's good. You're making a comparison. But as we know from you know, research methods, having an appropriate comparison is really important, especially when there's probably a lot of different confounding variables going on in that situation. So just comparing means of how many percentage of military connected youth graduated versus a percentage of how many students in South Carolina graduated. Yeah, I would be careful making strong conclusions based on that comparison. So there is a need for more research here. In general, important resources for military connected families and military connected youth. School liaison officers are amazing, and probably one of the first resources that you should connect with if you are going into a new school in a new school district. Typically, school liaison officers are at the military installation, so they would be at Joint Base Charleston, or that they would be at Robins Air Force Base, or that they would be at the actual military installation. And depending on if it's a lot of bases are joint, but depending on if it's Air Force Base or if it's Navy base, it might be the school liaison might be in a slightly different type of organization, but they're able to be found by most Google searches. In terms of prevention, promotion, early intervention, most mental health issues are addressed in primary care or family health, or a pediatrician's office. That's where the majority of care is first initiated or sought out, or the referral source. So programs like the Behavioral Health Optimization Program, that's an Air Force program, but I know that there's a counterpart for the Navy and the Army as well. But that's an embedded mental health provider within primary care. And they're an excellent resource. And in most military treatment facilities, that's the name of a hospital and a military installation, that's where their family health clinic is, and that's where you can get embedded with, or you can get connected with an embedded mental health provider. Pretty much every installation has a family advocacy program. We briefly spoke about military one source and MPLAX, and we briefly spoke about EFMP. But with family advocacy, they do a lot more of the domestic violence and child protection services on the installation. That they have a lot of really great resources for the prevention of domestic violence. So it's definitely a great resource to be plugged into. If you are curious, and this again isn't an exhaustive list, but I believe on the email that went out to register for this webinar, some very helpful human put together a list of resources that would be appropriate. So there's just a screenshot of the email that you should have received, so you have some of this information already. All right, so there are some really great resources, libraries, compendiums, websites of programs that have some level of research support. So for instance, SAMHSA has a National Register of Evidence-Based Programs and Practices, or NREP. The Department of Education has the What Works Clearinghouse. The Center for School Mental Health is an excellent resource for school mental health, school behavioral health programming. And of course, I have to say that the BASC website, that schoolbehavioralhealth.org, is excellent. It has some really great information on programs for military families and military connected youth. And all of these programs, or all these websites, typically have some level of rating for support for these programs. However, interestingly enough, a lot of these efficacious or effective programs have not been evaluated with samples of military youth or military families. Kendall Moore and colleagues did a great review in 2017 and found that for military connected youth, only 14 of the articles that they reviewed met inclusion criteria for their studies, for their review, and most of those had pretty fair to poor research support. The best resource for increasing family readiness is the Penn State Clearinghouse for Family Readiness. Its entire mission is to identify different programs and different resources that would be helpful for military families and military youth. But kind of same thing, when you take a look at, I looked, I think in the fall last year, and they had 1,300 programs listed where they rated, hey, this is what we think is effective, this is not effective, this has very little support, that's not their criteria, but it was something along that continuum. When I searched military families, that there were only 8 studies, there was only 8 programs with citations that had that was listed as being effective. So 8 over 1,300 is about 1/6 of 1%. So pretty small. So there's a lot of work to be done. We did say that military families have a lot of unique stressors, have a lot of unique things going on in their life. So we can't automatically assume that some type of prevention program or intervention is going to be helpful for military families just because of the unique nature of that sample and the unique nature of some of the things going on in their life. And if you guys remember, about 2 decades ago, this is a blast from the past, but this is it's a reminder of the Fort Bragg demonstration project. This was a very large evaluation project designed to detect the effects of a continuum of care mental health model. And it was at Fort Bragg and I believe a few other places. And they evaluated the services for military connected youth in those mental health clinics. And there was a lot of controversy at the time about the null results that this model found. And there's a lot of commentaries around 1997. I think I was in 3rd grade. I remember reading all of them. They were very interesting at the time. But I'm joking, of course, but they, a lot of people, there's a lot of rabble in the research. Some people blamed the evaluation approach. Some people blamed how the study was done. But there was a lot of resources put into evaluating the services that these mental health, or that these military connected youth were receiving, and there was no effects found. So, and a lot of the interventions were based on evidence-based, research-based interventions. So it's important that we not only test and evaluate programs for military connected youth and families in a research setting, but then also as we go on to deliver services, we need to make sure that we're collecting program evaluation data to make sure that these programs are working hopefully as intended. Some additional national resources. I would be remiss if I did not point you to the Military Child Education Coalition. They're by far the national leader in terms of military connected youth, and some of the resources that they put together for parents, students, and professionals. They have a lot of really excellent online trainings and in-person trainings as well. It looks like as we move forward, there's probably going to be some type of hybrid approach between online trainings and hopefully in-person trainings with social distancing. The Center for Deployment Psychology, excellent resources, a lot of things for clinicians, but then also moving to resources for professionals working in school. They're putting together some really great school-based trainings. And if you're in the area, the Carolina Network Meeting for School Mental Health will be in Asheville, North Carolina, this August 27th and 28th. And Carolina Network is a really great biannual training, and the Center for Deployment Psychology is going to come and deliver some of their trainings that are for school-based personnel. South Carolina really is tip of the spear with their Purple Star School program. Right after I separated from Robins Air Force Base and came back to Charleston, one of the first news programs I saw was at Richland 2, and there was a 3-star general in the South Carolina State Department of Education leadership talking about Purple Star schools. But it's a meaningful designation that recognizes schools and districts that have met specific requirements for training personnel, implementing programs and resources. They all have what's called a dedicated community liaison. So right now in South Carolina, there's only 3 districts that have met this pretty rigorous criteria for becoming Purple Star school districts: Richland 2, Aiken, and Kershaw County. So they all have dedicated community liaisons. They have a student ambassador program, educational planning, and they adhere to what's called the MIC3 Military Interstate Children Combat Commission. And that's designed to address educational concerns as military families transition from school to school, and ensuring that military families and military students receive a credit for the courses they've completed. But the Purple Star School Program also has really great training that they're required to do for staff members and extracurricular activities as well. Really great program. South Carolina Department of Education is doing some excellent work as well. This morning, I believe at 8 o'clock, starting on Facebook Live, they were streaming their military honor cord ceremony for high school seniors. So graduating seniors who are entering the military or attending a academy for one of the different military branches were able to wear a special cord for their high school graduation. And this is significant. Actually supporting youth to be able to enter the military through the school system is really important. Before COVID, the Surgeon General's one of their top national security priorities was to address this issue that 7 out of 10 graduating high school seniors would not be eligible to enter the military. 71%, that's huge. And the vast majority of the reasons were things like obesity, educational deficits, mental health, criminal or drug abuse records. But the Surgeon General is very focused on COVID right now. But before that happened, he said, one of my top priorities is that high school seniors won't be able to enter the military. And school behavioral health has a huge implication for prevention of all those areas. So the South Carolina Department of Education is doing really great work to support high school seniors entering the military. Also working on military spouse teacher certification, making that process easier for spouses coming into South Carolina to be able to work as certified teachers. I believe the Psychology Board is also working on programming to make sure that psychologists, if they're coming in and their spouse is a military service member, are able to gain the ability to work in the state in a reasonable time fashion. And then Purple Up April is a big campaign. April was a very weird April this year, but every April is Purple Up month. Well, there's typically a lot of promotion and prevention and awareness campaigns for military youth for the month of April. And lastly, but not least, one of the very exciting things is the creation of the University of South Carolina Military Family Forum. The research literature is very clear that we need to improve awareness, the needs of military family members to civilian organizations. We need to better train civilian helping professionals to work with military families. And, as I was leaving the Air Force, it was becoming leaner and meaner in terms of what it was offering military families. The focus really was on deployability and being able to support service members downrange, and a lot of services seemed like they were going downtown to network providers in terms of providing military family member services. And then also the goal of the Military Family Forum at UofSC is to develop partnerships to support military family members in the Southeast and nationally. So go ahead and mark your calendars. Next April 2021 will be the first annual UofSC Military Family Forum. It was supposed to be last month, but for some reason nobody was able to get together in groups of people and meet last month. So April 15th and 16th, only 10 and a half months away. If you are interested in participating in the Military Family Forum, which is intended to be a regional Southeastern forum, and building on some of the really great work that South Carolina is doing as a state. Hey, please go ahead and save the date. I'm sure if you signed up for this email, you will be getting lots of emails about signing up. I believe the plan is both blended, both online and in person. I'm sure Taylor Davis can address all your questions immediately about what April 15th and 16th is going to look like.
Well, I have to calm down my laughter at first because I loved how you said, you know, I can't imagine what it was that shifted our framework for the conference this year. I think first and foremost, I want to make sure to highlight the fact that we've had so much engagement, just positive feedback, John, over here from folks, just, you know, singing your praises. So we've got a wife of an Army officer for 22 years and still going. Congratulations, keeping it going strong. Mom of 3 military brats with a smiley face. Too many schools to count for them. What she was expressing to us was major props to the DODDS/DODEA school for programs that they have in place to connect students and others to supports, one of which she highlights being school-based MFLACs, which are so important. And for those of you that may get a little bit lost in, you know, our alphabet soup, as we all call it, military and family life counselor programming through Military One Source. And then we had another positive feedback, great information, great resources and data, much research. It's definitely needed towards COVID-19, which has validated the unique needs of military families. And what I was sharing with our community here is that on our website, we are constantly updating our repository of population-specific, COVID-specific resources. And so we will certainly bolster and strengthen any resources that we have for military-connected youth and families. So please feel free to always share that information with us. And in regards to the upcoming conference, as John indicated, we are looking at a blended conference for those individuals that may still, you know, have travel restrictions but want to be able to engage. So we're certainly looking at some really innovative conference software for that. So you can look towards having that information come out for you. We still will, barring any, you know, other unprecedented events, be planning to have the conference in person as well. You can have you can access all of that information on our website. And I think that, you know, today we've got, let's see here. Thanks for sharing info on the Purple Star districts. We are committed to providing more resources and support for our military families and students. Richland, our partnership with Dr. Terry and UofSC Military Community Liaison. Richland too values our partnership with Dr. Terry and UofSC, and has been a dear friend of mine for more years than I think either one of us would like to go ahead and put on record. But he's been an incredible advocate, an incredible ally, an incredible resource in every way. And we are just so beyond appreciative to have you give us your time today. We know that time is a premium. It is very clear that this was a much needed conversation. Perhaps there's opportunity for us to expand on some of these pieces, maybe even expand on the Military Family Forum going forward. And just really see what we can do to activate the resources that we have in our community, as so much of, well, the foundation of what we do is to have this beautiful community of practice, to which we're grateful for all of you being here today. I know that we only have maybe about 2 minutes. I want to open the floor for any questions that we may have from any folks that are on calls. You can press *6 in order to voice your questions. Certainly put that in the Zoom chat. If not, we will let y'all escape a little bit early. And I say a little bit very intentionally, and make sure to connect you all with this webinar, as well as Dr. Terry's slides and connectedness to our resources within the Behavioral Alliance of South Carolina, as well as the Southeastern behavioral community as well. So I will wait for a few more questions, and if not, we can all escape and hopefully do some self-care, or maybe just a deep dive into what we've spoken about today from John. Any last words, John?
Hey, thank you all for attending. Thank you for the excitement and enthusiasm. That there's great momentum in South Carolina, and looking forward to working with everybody that participated on to support military families and military connected youth. So thanks.
All right, y'all. Well, with that being said, please go ahead and register for next month's webinar. We've got Dr. Aiden Iacchini. She'll be presenting on transition supports and helping to reduce high school dropout. I'm certain that she will also be touching on some COVID-related information. We're trying to make sure that we acknowledge that this new normal that we're going back into, and I use the air quotes because we don't all really know what that means, but we certainly want to make sure that we're focusing on doing all of the wonderful things we can do to support all of our different populations. John, you've got a few more wonderful quotes here. Great info, outstanding effort, John. Again, we're so grateful for you, and we're so grateful for all of you that took the time to attend today. So with that being said, we will wrap up. We will make sure that y'all have access to everything that we have provided today on our website. If you have any recommendations for future content or webinars, working through it Wednesdays, basking in the spotlight, or curious what those might mean to us here at the Behavioral Alliance of South Carolina, please follow us on our Facebook page, follow us on Twitter, on Instagram, and be a part of our community. We are grateful for each and every one of you. Thank you so much, and we will look forward to seeing y'all at next month's webinar. All right, y'all have a fabulous evening and a fabulous afternoon. Self-care, everyone. Bye now.